difficult for me. Okay. My report with the genetic significance of endothelial dysfunction. One moment. Diabetes mellitus is a global public health problem. One of the most important mechanisms for the progression of the long-term diabetic complications is considered to be dysfunction of the vascular endothelium. Initial structural and functional changes in blood vessels occur long before the formation of clinical signs of angiopathy. According to modern concepts, endothelial dysfunction is a violation in the balanced process of vasodilation and vasoconstriction, pro- and anti-thrombotic reaction, proliferation and suppression of cell growth, pathological angiogenesis, and disruption of intracellular interactions. Our studies aimed at assessing the role of endothelial dysfunction in the development of diabetic angiopathy, as well as improving the quality of early diagnosis of vascular complications of diabetes mellitus by developing and testing in clinical practice and methods for the quantitative determination of circulating endothelial markers, endothelin-1, von Willebrand factor, endothelial nitric oxide synthase. So we need to be strong. 184 participants were recruited. Group 1, 124 patients with diabetes mellitus, including 31 with type 1 diabetes and 93 with type 2 diabetes. Second group, 30 patients with arterial hypertension, control group, and third group, 30 relatively healthy persons. There was no significant difference among group, the diabetic patient in comparison group of the control according to the main gender and age characteristic. Routine clinical examination included interview, history talking, physical examination, and anthropometry. Complex of lab tests, blood and urine test, biochemical parameters, fasting glycemia, daily glycemia profile, and glycated hemoglobin. Ophthalmoscopy of the fundus, dosimetry, tonometry, ECG, blood pressure measurement, echocardiography, orthostatic test, and Valsalva test. Nitroalbuminuria, calculation of glomerular filtration rate, Doppler ultrasound, and assessment of various types of sensitivity using DNA scale and neuropsychological study. All participants in the study underwent determination of the level of endothelin-1, von Willebrand factor, and enosynthase in blood serum, but enzyme-like immunosorbent assay using standard kits by Biomedica, Techniclone, and IND system in United Kingdom. Various types of diabetic angiopathy were diagnosed in 107 patients with diabetes mellitus, 86.3%. The structure presented on this slide. The most common microvascular complication was diabetic nephropathy of various stages. Most often in patients with type 1 and type 2 diabetes, diabetic nephropathy was found in the proteinuria stage in 42.3%, and then isolated or in combination with diabetic retinopathy. In patients with type 2 diabetes, various forms of coronary artery disease in 70.9%, cerebral vascular disease, and angiopathy of lower extremities were identified. The maximum increase in level of endothelial-1 and von Willebrand factor was noted in the group of the patient with diabetes mellitus, significantly exceeding similar indicators in the group of healthy individuals by 3-5 times. In patients with arterial hypertension, the indices also significantly exceeded those the control group. However, they were significantly lower than in those with diabetes mellitus. The decrease in the level of NO synthase in patients with diabetes mellitus was significantly different from the indicators both in the group of the patient with hypertension and in healthy individuals. The frequency of detection of elevated levels of endothelial-1 and von Willebrand factor in the main group 76.6%. In the group of patients with hypertension and healthy individuals, similar indicators were significantly lower. The decrease in the level of NO synthase was most typical for patients with diabetes, in contrast to the group of patients with hypertension and healthy individuals. When analyzing the dependence of severity of endothelial dysfunction on the duration, diabetic duration, it was found that the violation in the endothelial profile in a patient with different duration of diabetes is aggravates with an increase in the duration of disease. The long course of the disease is accompanied by significant increase in the level of endothelial-1 and von Willebrand factor. In patients with diabetes, duration of more than 15 years. A decrease in level of NO synthase was typical for any periods of the disease. The increase in the level of glycated hemoglobin was most associated with raised endothelial-1 in the blood of diabetic patients. Significant increase in the level of endothelial-1 associated with a progressive deterioration in the quality of glycemic control. The excess of endothelial-1 and von Willebrand factor levels in the group of diabetic patients with vascular complications is significant in comparison with patients without diabetic angiopathy, hypertensive patients, and healthy people. The maximum level of endothelial-1 was noted in individuals with diabetic retinopathy, 2 picomole per milliliter, and diabetic polyneuropathy, 1.99 picomole per milliliter. The level of von Willebrand factor was also increased in all variants of diabetic angiopathy, with the highest value, 6.74 units per milliliter, noted in the group of patients with macroangiopathy. It should be emphasized that in the group of patients with diabetes mellitus, in the absence of diabetic angiopathy, the changes in the studied parameters differed from those in the group of patients with hypertension, which mainly indicate the activation of the endothelium and the development of endothelial dysfunction in the early preclinical stage of the vascular damage. The level of endothelial-1 increases with the progression of disease. progression of disease, and reaching the highest value at the late stage of diabetic retinopathy. The level of von Willebrand factor is maximally raised in patients in the pre-proliferative stage of retinopathy, significantly decreasing by stage 3. The highest level of endothelin-1 is associated with proteinuria, while von Willebrand factor is highest in the group of patients with microalbuminuria. Evaluation of the effectiveness of determining the levels of endothelin-1, von Willebrand factor, and NO synthase for the diagnosis of the various types of diabetic angiopathy is presented on this slide. The predictive power of the test was determined by area under the curve. Endothelin-1 proved to be the most informative and versatile test for detecting diabetic angiopathy. At the optimal threshold value of 1.78 picomole per milliliter, the predicted value of a positive test for diagnosis of diabetic retinopathy and diabetic polyneuropathy was 71.8%. And for diagnosis of diabetic nephropathy and various types of angiopathy of the lower extremities, 83.3%, with a reference value of 1.81 picomole per milliliter. Factor von Willebrand showed the greatest efficiency in terms of detecting diabetic nephropathy, with a reference value of 5.11 units per milliliter. The predictive value of positive test was 72%, and the negative test was 53%. The maximum area under the curve was noted when plotting the RO curve for von Willebrand factor in relation to low extremities macroangiopathy. Using a reference value of 5.37 units per milliliter, gave a predicted value of positive test result of 70%. The determination of NO synthase turned out to be the most effective for diagnosing low extremities macroangiopathy, with a reference value of 266 picogram per milliliter. The predicted value of positive test result was 68%. Endothelin-1, in conclusion, endothelin-1 to be the most informative and universal test for detecting diabetic angiopathy in terms of area under the curve. Analytic characteristic of determining the levels of endothelin-1, von Willebrand factor, and NO synthase in various types of diabetic angiopathy are presented on this slide, and the diagnostic efficiency of all the described tests was determined in the range of 62–63%. In conclusion, the results of our study indicate the clinical significance of assessing endothelial dysfunction in patients with diabetes mellitus and the possibility of determining the levels of circulating markers for the early diagnosis of diabetic angiopathy. The study of circulating endothelial markers can be used both as a method of assessing the potential risk of vessel damage of the various sizes and for purpose of diagnostic certain types of diabetic angiopathy. with the most significant vascular complications of diabetes mellitus, the determination of the DLE1 from Willebrand factor and endosyntase is good analytic characteristic. Thank you. This is my address. I'm ready to answer your question, and sorry for